Okay, good morning, students. So today I'll be teaching you all the these important questions. So can you see the screen? Can you see the screen?
Yes, ma'am.
Yes, ma'am.
Okay, can you please tell me yesterday up to how means up to what point or up to what number I have taught you all yesterday? Was it till 50 or else yesterday? I think yesterday I taught you till yes, I taught you all till 15. And today, yesterday, whatever I taught, and today, whatever question I taught, I will be sending you all the PDF by today. So yesterday I was planning to send, but still I was again thinking. So to get means I will send together with today whatever I take. So I taught you all till 50. So we'll start from the 51. So let us see what is the question number 51. So the question is the best long-term solution for kidney failure is means like there are many solution there are so many solution or there are so many like management that we find to treat for the kidney failure, but here the question what it is asked is what is the best long-term treatment solution for kidney failure. So the answer is kidney transplant. Okay, actually dialysis is also the treatment for the dialysis is also the treatment for this kidney failure. Okay, that means kidney transplant, dialysis, all these they are the this treatment. But the thing is that what the question asks is the best one. Okay, the best long-term solution. So if someone did kidney transplant, okay, and if he or she can survive from that transplantation of the kidney, then that would be the most favorable conditions for him or her to stay long term. So that is why option number 1A is correct. Are you clear why option number A is correct? Yes or no?
Yes, ma'am.
Yes, ma'am.
Okay,
Yes,
next.
ma'am.
Okay, let's come to the next. What are the symptoms or what are the symptoms of suffering from kidney disease? So if a person suffer from kidney disease, so what type of symptoms he or she will have? So the options are he or she will have high BP. Is it correct? अगर किसी का kidney disease हुआ तो he or she will have high BP. Is it correct? Yes or no?
Yes.
Yes,
Okay.
ma'am.
Yes.
Okay. Will he or she have respiratory problem? Difficulty in breathing, soreness of breath, all those things. Will he have?
Yes, ma'am.
Yes,
Okay.
ma'am.
Okay. And then will he or she have swelling of face, leg, etc. All this? Will he have edema? I mean to say.
Yes,
Yes,
ma'am.
ma'am.
So
Yes, ma'am.
that is the reason why the answer is all of the above. So are you clear? Are you clear with
Yes,
Yes,
the
ma'am.
ma'am.
okay?
Ma'am.
Let's move on. So here, see the question, read carefully, okay? The kidney are responsible for performing all the following function, okay? Means our kidney, they are responsible for performing all the following function, okay? Except, so let us see which one is the answer. The answer is maintaining cortisol production, okay? It means activation of vitamin D means this activation of vitamin D, this is also the function, okay? This is also the functions, and the secreting renin to renin secrete karta hai, or this is also the function, okay? And then secreting erythropoietin, this is also the functions. But this maintaining cortisol production, okay? So these are not responsible, okay? This maintaining cortisol production, these function are not responsible for performing the functions. This the kidney function, okay? So that is why this is the answer. So let us come to the next point. Individual, okay? This was explained by Surajit, I think. This was explained by Surajit. So I think uh, every one of you know. Individual who need a kidney transplant usually undergo a artificial treatment called dash until a suitable kidney is found. So individual who need a means a person, okay, a person need to do kidney transplant. He or she is planning to do a kidney transplant, okay. So until he or she found the proper kidney, okay, which is suitable for him or her. But before he find that suitable kidney, what he need to undergo is that he need to undergo a treatment, okay, and the name of that artificial treatment is known as hemodialysis, and this was explained by Surajit, I think, and in your this applied physiology. Is Surajit, am I right? Surajit, can you hear me?
Yes, ma'am.
Hemodialysis?
Yes, ma'am.
So this hemodialysis, this is the artificial treatment, okay? This is also type of dialysis, this artificial treatment, which is done, okay? So that is why the options number A is correct. So if it come in final exam, you just choose this with understanding. Okay, let's move on. Which is the best method to, and whenever you read the question, you just read the question very carefully, because all the option used to be very similar. You will think that option A is also correct, B is also correct. But in order to remove that confusion, now you have to read the question very carefully. See this question also. Which is the best method to detect kidney cancer? So there are many diagnostic evaluation. Now there are many diagnostic evaluation that I used to give you all, like with these if you do CT scan, if you do MRI, if you do this complete blood count, all this, with this you can detect that a person have kidney cancer or not. All those are the also the diagnostic evaluation, how you can detect. But here the question asks that which is the best method, कौन सा वाला best method है जो kidney cancer को detect करता है, कौन सा वाला best method? So the answer is option number D, that is uh, renal mass biopsy. So renal mass biopsy is the best correct answer to detect the best method to detect the kidney cancer, because I already explained ना, renal mass biopsy में क्या करता है, kidney से direct cell निकाला जाता है, that means tissue निकाला जाता है from your kidney. Some part of your kidney is being taken out, okay. So, the tissue is being taken out, then it is observed under the microscope. So it is direct kidney ka tissue ko le raha hai, so it is very easy, or it is the best method, okay, to detect the kidney cancer. That is why option number D is the correct answer. So are you clear why this is the answer? Are you clear?
Yes, ma'am.
Yes,
Yes,
ma'am.
ma'am.
Okay, let's move on. So which one is not a risk factor that increase chances of getting kidney cancer? So the question is that which one is, these are the option, okay. Now you need to choose that among this option, which one is not a risk factor, okay, that will increase the chances of someone getting kidney cancer. So which one is not the risk factor that you need to choose? So smoking, obviously smoking can cause kidney cancer. Is it correct? Can smoking cause kidney
Yes,
cancer?
ma'am. Yes, ma'am.
Yes, very good. Can drinking of alcohol cause kidney cancer?
Yes, ma'am.
Very
Yes,
good.
ma'am.
And then workplace exposed to chlorinated chemicals, so many chemicals. Now all this I explained, albastols, all this I give you all. So can the workplace that is exposed to chlorinated chemicals can cause a person suffer from kidney cancer? Yes or no?
Yes, ma'am.
Oh, yes. Oh, okay. So, and can nephritic syndrome patient, this nephritic syndrome, this is the disease, can this cause someone with kidney cancer? Yes or no? I already explained nephritic syndrome, that they have I ever mentioned the cancer, this and all. Can is nephritic syndrome the risk factor that will increase someone getting the chances to develop kidney cancer? Yes or no?
Yes, ma'am.
Anyone other? Samuel?
No,
You
ma'am.
No, because it is related to inflammation. Now, if the option is given like PKD, polycystic kidney disease, then you can consider that those polycystic kidney disease, those patients, they can have the high risks of this getting kidney cancer, because there is a like mass formation, no? There is a cyst formation, so it's very much like chances. But nephrotic syndrome, in this inflammation and all, no? There is less chances to develop this kidney cancer. So this nephrotic syndrome does not come under the risk factor of getting kidney cancer. So are you clear? With 51 to 56, are you clear? If yes, I will move on, because we have to
Yes,
complete.
ma'am.
ma'am. Yes, ma'am.
Okay, we have to complete very fast. Okay, next is what? Okay, 57. Oh, this is very important. Okay, so the normal creatinine level in our blood of an adult male is, so here it is not asked about female. Okay, the question is the normal creatinine level in blood of an adult male is, which one is the answer? So this is the numerical value, this cannot be any change. So we did the answer, the correct answer is 0.6 to 1.2 mg per dl. So the normal creatinine level in blood of an adult male is, okay, the answer is 0.6 to 1.2 mg per dl. In some book it used to vary, okay, it used to fluctuate. Sometimes you will find that 0.7 to 1.2 mg per dl, so that is almost approximate, okay, but it is 0.62 means 1.2 milligram per dl, till it is per dl means per deciliter. So number one is the option. And number two is C. It is also very confusing. Nah? 0.6 is also given, but 1.2 here, 1.5. There is a difference in 1.2 and 1.5. So this is there is, you can see the difference here. So don't get confused between these two. Okay. It might start with 0.7 to 1.2 and or else 0.6 to 1.2, but it ends always with 1.2. It is still, this is the range. Okay. So 0.6 to 1.2 milligram per dl अगर मैंने option में दिया, या फिर if I give 0.7 to 1.2 mg per dl in option A and B, so which one you will choose? This is a very tricky question. Okay, suppose in option A I gave that the normal creatinine level in blood of an adult male is 0.6 to 1.2 milligram per dl, option A. और option B में अगर दिया कि 0.7 to 1.2 milligram per dl. So will you choose the answer option A, option B, or what will you choose? Anyone? The one who can answer will be very brilliant. Ishan, can you please answer? Ishan? Ishan, are you there?
Yes, ma'am.
Okay, Ishan, see the question nicely. The normal creatinine level in the blood of an adult male is. So adult male का creatinine level in blood, na? इसका creatinine level. The normal value here, it is given option. The answer is 0.6 से लेके 1.2 mg per dl तक. So if I give the option option A as 0.6 to 1.2 mg per dl, and in option B, if I give 0.7 to 1.2 mg per dl. So will the answer be option A, yeah, option B, or else both are correct?
Ma'am, A is correct.
A is, are you sure? So let me explain, okay? See carefully. Okay, let me ask to Tumpe, which one will be the answer? अभी मैंने जो बोल रही थी, Tumpe, Miss Tumpe,
Yes, ma'am.
कौन
Yes,
सा वाला
ma'am.
करेक्ट आंसर होगा? अभी मैंने जो बोला था क्वेश्चन, आई वोंट रिपीट. ऑप्शन ए या ऑप्शन
Ma'am, option A.
ऑप्शन ए? सृजना, ऑप्शन ए और ऑप्शन बी?
Ma'am, I guess both are correct.
Yes, very good. Both are correct. Okay, both are correct. See, Ishan, can you hear me? Tumpe, can you hear me?
Yes, ma'am.
Yes, ma'am.
Okay, see why both are correct. देखो इसमें क्या दिया है 0.6 to 1.2 मिलीग्राम ना, उसका मतलब है कि 0.6 से लेके 1.2, तो 0.6 में जाके क्या होगा 0.6, 0.7, 0.8, 0.9, it will go like that, isn't it? Yes or no?
Yes, ma'am.
Yes, so 0.6 से लेके जाके numbering तब 1.2 तक बोला है. So it can be normal. So that means both are correct. So if someone give like that type of tricky question, don't get confused. Just directly choose both are correct. Is it okay? Are you clear?
Yes, ma'am.
All of you?
Yes, ma'am.
Okay.
Yes.
Okay, let's move on. The next question is glycosuria is the presence of what every one of you know, no need to explain this. Glycosuria. Glycosuria from the name itself, glycosuria. Glycosuria is the presence of Finisha. Glycosuria is the what is glycosuria?
Glucose, presence of
Glucose is
glucose
present where? Where?
in the urine.
Yes, very good. Glycosuria is the presence of glucose in urine. So from the name itself, you can see glucose, glycosuria, glucose. So glucose are present in the urine. So that is why option C is correct. Okay, let's move on. So hematuria is term presence of blood in. So all this one, see the question. Hematuria is term presence of blood in urine. So all of you know this. Hematuria means presence of blood in urine. I won't repeat. Okay, this is the another question. Presence of crystal in urine is called, from the name itself, we will get the answer. Presence of crystal. हमारा urine पे crystal present है. So presence of crystal in urine is known as what? Virginia. Presence of crystal in urine is known as what? Virginia.
Crystalluria.
Yeah, presence of urine, crystal. Crystalluria means like how will you understand? Crystalluria means like means the urine specimen. Okay, that particular urine specimen is oversaturated. Okay, with crystallogenic substance, it's oversaturated. So agar हमारे urine पे crystal present है, that means if crystallogenic substances are present, then that is termed as this crystalluria. So that is why option B is correct. So let us move on. So the following is the complication of urinary tract obstruction except. So question अच्छी तरह पढ़ो. The following is these following, okay, these following, these are the complication of urinary tract. ये सब urinary tract infection का complication है बोला. So now it is asked that which one is not. The following is the complication of urinary tract obstruction except. So which one is not the complication? So obviously infection. Okay, see the question. Can infection let the person suffer from urinary tract obstruction? Have the complication of UTI, urinary tract obstruction? Infection. Can infection
Yes,
lead
ma'am.
to, okay, correct, okay. Okay, can hypertension like lead to like let a person have complication of urinary tract obstruction? Hypertension. Hypertension तो क्या कब वजह से होता है? बहुत सारा क्या क्या डिजीज होने से hypertension we used to get ना because of many problems. So this is the most common symptoms you find anywhere and the most common complication you find everywhere in kidney disease. The following is the complication of urinary tract obstruction except. So the answer is diabetes. Okay, this diabetes. This means this infection, this hypertension, this chronic renal failure, all these are the complication of urinary tract obstruction. Okay, but except diabetes. Diabetes, this is not the complication of urinary tract obstruction. So all this were not my part, but still you should know all this urinary tract obstruction. How does all this occur? So how much question I already gave you from 51? Okay, 51 to 56, again from 57 to 61, and again this, okay, 62. Okay, time is still there. Let us discuss fast. Okay, the normal range of blood potassium is, you all already got this normal range of potassium, sodium, all this you all know. So the correct answer is this number 1. So is it okay? Option 3, the normal range of blood potassium is 3.6 to 5.2 millimole per liter. The option given is the option A. So is it correct? Or else the normal value is something else. Is it correct? Normal range of potassium? All of you? All this you have in your notes. Normal range of potassium. I think in your this other subject, normal range of potassium. All this. If you won't know the normal range of potassium, then how will you detect that a person have hyperkalemia? So पहले normal value जानना है ना, then only तुम बता पाओगे कि उसका hyperkalemia हुआ है. So what is the normal range? Say, all of you. Yes, I have given the option of answer is option A. So is it correct or it's wrong? Or you all don't know the normal value of potassium, blood potassium? Samuel, is the answer correct?
Yes, ma'am.
Yes, this is the normal value of blood potassium is this. All of you like, why you all always used to be silent? Means you try to answer all these things because अगर normal value ही नहीं जानोगे तो तुम कैसे चीजों को detect करोगे? Try to know all these things. That's why I
Hello,
did
ma'am.
not. Yes, I thought that I of not explaining all this because all these were given before, not by me but by other teacher. All this normal range and all potassium. So 3.6. Where you given this? Yes.
If it is 3.5 to 5.5, it is also normal.
Yeah, it's normal. It's normal. It's normal. Yeah, it's correct. But it because it's approximate, no? So it's correct. It's correct. So what value was given to you all?
3.5 to 5.5.
Yeah, it's correct because all those are approx, no? So 3.52 means what? 3.5 and then 3.6, no? So it's still 5.5. So 5, it is near. So it's approximately. So it is correct. Okay.
Okay, ma'am.
Okay, because
Yes,
every year the value used to fluctuate. Okay, so it's not that is wrong. It used to fluctuate, but if it fluctuate also, it used to be like approximately it used to be. So in that you can differentiate along with the other options. See how this is so high, again this, so like this you can differentiate. So next, the next is following are the organs of urinary system except. So the following are the organs of urinary system. The urinary system ka organs, so I already explained. It's not it. I already explained very nicely which one is in this lower urinary tract and which one is in the upper urinary tract. So now tell me among all the options, that option A, B, C, and D, which organ, okay, which organ is not a part of urinary system? So bolo to koi. Which organ?
Prostate.
Okay, prostate. Okay, very good. So in order to know that prostate is not the part of urinary system, okay, so urinary system, so can anyone tell me in upper urinary tract what we have, and in lower urinary tract? It would be best if Ishan answer this question. Ishan, tell me lower urinary tract में क्या था और upper urinary tract में क्या क्या organ था? जल्दी बोलो. Say fast.
लोअर में वो urethra and bladder,
And the
और
other
upper
one?
में kidney and ureter.
Okay, Ishan, thank you. Okay, so now let's move on. So all of you understand now why prostate is the answer? All of you? All of you?
Yes, ma'am.
Yes, ma'am.
Okay.
Yes, ma'am.
Let's move on. So next is the the best method for the cure of urinary tract obstruction is, okay, what is the best method? So the best, if there is obstruction means what? Obstruction means something blockage, okay? And whenever there is some blockage, and if you perform or if you undergo surgical method, okay, through surgery, if you directly remove that obstruction, okay, through the surgical method, then that would be the best method, okay? And then not just by giving analgesic. Analgesics will just relieve your pain, okay? Analgesics will just relieve your pain, or else just by increasing the fluid intake will not be the best, like the best remedies or the best method to cure for urinary tract obstruction, okay? So these are just the basic or the simple method, okay? So what is the best method is that if you find some urinary tract obstruction, okay, person have urinary tract obstruction, so suggesting them to perform surgical method, okay, in order to relieve that obstruction is the best method. So surgery performed करने के लिए बोलना है और तब the obstruction can be relieved. So are you all understand why option A is correct and these are not chosen? These are not chosen, and why this is chosen? Are you clear? All of you?
Yes, ma'am.
Yeah.
Okay,
Yes,
okay.
ma'am.
Oh, Srijana, please take attendance, okay? Only 8 minutes left, okay. So, but I'll try to complete this 67 question. Okay, in case of chronic renal failure, okay, dialysis should be started when, this one you need to know, okay? You direct see. In case of chronic renal failure, okay, when a person have chronic renal failure, dialysis should be started when this BUN, that is blood urea nitrogen, is 100 mg per dl, or else it is more than this, okay? Or else if the serum creatinine is 10 mg per dl, or else when it is above this. So if you find this type of complication, okay, if this type of results in the investigation, then at that time you can suggest that a person should start for this dialysis, okay? So these two option number, this one, this is correct, okay? Both the option A and the option B both are correct. So in the option C, I have given A and B both, na? So the option C is correct. Okay, so whenever someone asks you, means in case of chronic renal failure or chronic kidney disease or end stage renal disease, okay, डायलिसिस शुड बी स्टार्टेड व्हेन, कब डायलिसिस शुरू करना है? जब किसी इंसान का ब्लड यूरिया नाइट्रोजन इज 100 mg per dl, or else it is above, or else his or her serum creatinine level is 10 mg per dl, or else if it is above. So this is how you need to choose the option. So are you clear? If it come in
Yes,
example,
ma'am.
okay. Okay, now let us see what are the common causes of chronic renal failure. Okay, the common causes of chronic renal failure. So the common causes of chronic renal failure is chronic interstitial nephritis. So chronic interstitial nephritis, okay, this, that is inflammation, this of the kidney tubules. All this can also be the causes of this can also lead to chronic renal failure. Okay, obviously if there is some inflammation, then obviously that can lead to chronic renal failure. And long-standing partial urinary obstruction, because if a person have for a long period of time, if a person have urinary tract obstruction, okay, there is some obstruction, so then that can also lead to chronic renal failure. So these are some of the common causes. Okay, so both A and B are correct. So this is option C. So let us move on. Anuria. Anuria. What is anuria? Anuria is termed when, this is a very tricky question. You just see nicely, okay? Anuria is termed when the urine output per day is less than 100 ml of urine. So Ilasara, is it correct? Option A.
Yes, ma'am.
Yeah, okay. Because I have given you, anuria means when the urine output is less than 100 ml. Okay. So, if the urine output is less than 50 ml of urine, so can that be anuria? Srijana, can that be anuria if the person have less than 50 ml of urine? Will you call that person means have anuria?
Yes, ma'am, because it comes under less than 100 ml of urine.
Yes, very good. It come less than 100 ml because that's why, just like before, that value. So don't get confused. It comes under the less than 100 ml. So less than 100 means 100 se come. It might be 90, 80, 70, 60, 50. So, and then complete cessation of urine. So it might be like complete cessation of urine. So that means the urine might not be like completely like not available, or complete cessation stop. So is this correct? I have given you all this, so I think you know. Is it correct, this option D?
Yes, ma'am.
Okay. So that is why the answer is all of the above. That is option D. So are you clear with this? 62 to 67? All of you?
Yes,
Yes,
ma'am.
ma'am.
Yes,
Okay.
ma'am.
All this question, okay? Don't just like memorize it, understand, and then study, okay? So let us move on a little bit more. 4 minutes left. So let us discuss this. Excess unused glucose in the blood may damage the nephron of the kidney, causing causing diabetic nephropathy, renal hypertension. And then the other one is chronic renal failure. So the answer is option D. Okay, both A and C are correct. That means excess unused glucose in the blood may damage the nephron of the kidney, causing. That means if there is an excess amount of glucose, okay, that is unused glucose. If there are excess amount of glucose present in our blood, then that may damage our nephron, okay? And if our nephron, then that if our nephron are damaged, then what can happen? What can happen? It can lead to this diabetic nephropathy, as well as it can also lead to this chronic renal failure, because when you have a large amount of glucose, okay, that is not being secreted or excreted, okay, glucose. तो अगर किसी का शरीर पर बहुत सारा ग्लूकोज होता तो what is that person might have this diabetes, okay, because excess amount of glucose that can lead to this diabetes mellitus. So unused glucose in the blood, okay, there are so many unused glucose in the blood. बहुत ज़्यादा glucose शरीर पे blood पे है, and then that excess amount of glucose in the blood that may damage our nephron, okay, nephron of the kidney, okay, and that can cause what? That can cause a person have diabetic nephropathy as well as chronic renal failure. So that is why A and C are correct. So are you clear? Are you clear?
Yes, ma'am.
This is very easy. So this one I will wait. What is okay? Let us discuss one more question for the last time. See the last one. Azotemia manifests as elevation of, what was azotemia? What was azotemia? Rifen, what was azotemia? Azotemia. Okay, whoever know, can you please tell me?
Ma'am, high level of urea and nitrogen in blood.
Yeah, high level of urea, nitrogenous waste, all this, okay? So urea, nitrogen, creatinine, BUN, and creatinine, all these are the like this product, okay? So it's product. So all this, if there is elevation and increase all this, then that is the meaning of azotemia. That is why option C is correct. If there is an elevation of urea, creatinine, nitrogen, okay, all these compound, if they are elevated in our blood, then that indicated is azotemia. So are you clear, all of you? Are you clear?
Yes, ma'am.
Okay,
Yes, ma'am.
Okay, I want to continue more, but it's only 1 minute left, so we will end till here. So many questions left. I just hope we will be able to complete before your final exam. Okay, Srijana, are you done with attendance?
Yes, ma'am.
Okay. Okay, all of you understand today whatever we have discussed, the question, the important question, all of you?
Yes,
Yes,
ma'am.
ma'am.
Okay, then that's all for today. Okay, have a nice day.
Thank you, ma'am.